I'm Mohit, and I'm working on treating and preventing blindness. When I was younger, I remember watching my granddad struggle with his vision. He would really squint his eyes to see our faces. It was frustrating for him, but also heartbreaking for us. But unfortunately, this is the reality for many families. Over the last centuries, we have made incredible progress in healthcare, allowing people to live longer, but with aging comes an increase in diseases like cancer, diabetes, and eye conditions such as age-related macular degeneration, or AMD. AMD is one of the leading causes of blindness worldwide. But this isn't the future that we want for our grandparents, our parents, or even for ourselves. So, to protect the vision of our loved ones, we need new drugs to treat AMD. But before we can use any of these drugs, it must be tested in lab settings to check for their safety and efficacy. But how can we do that? Right now, scientists have two main ways to test drugs. First, by growing cells in the lab, and second, by using animals. The first method, cell culture, is simple but doesn't replicate the human eyes, while the second animal model is more complex, but animals do not have the same eye structure as humans. And of course, there are ethical concerns of using animals. Since neither method is perfect, I am developing a new way to test eye drugs by growing human cells in the lab, alongside actual human retina tissue. Think of it like this. When we are babies, we learn new things quickly. So I take adult cells and teach them to be young again, turning them into stem cells. Then I guide them to grow into retinal pigment epithelial cells, or RPE cells. These cells are like retina's best friend. They protect it, they reduce the stress, and they keep it functioning properly. I then bring both the retinas and RPEs together with human retina tissue from donor eyes so they can interact with each other just like they would do in real human eye. They are happier together and even live longer for up to a month. This model will allow us to test AMD drugs faster and in a way that better reflects the human eye, making our results more accurate, helping researchers develop new treatment that actually works for the patients. In the end, my work bridges the gap between traditional research methods and real patient needs. My goal is simple: to help bring better treatment to people faster, so future generations, ours included, can see the world clearly for years to come.